Hey everybody out there listening. On behalf of the Quality Assurance, Quality Improvement team here at Allegiance Mobile Health, my name is Adam Baer, and this is your Medic Minute. In today's Medic Minute, we will discuss the use of end-tidal CO2 as a way to recognize sepsis in our sick patients. Now, for our patient that we suspect may be heading towards sepsis, their cells, which normally use oxygen as energy, which we often refer to as aerobic cellular respiration, start to see a decrease in available oxygen due to the underlying illness. This in turn causes our cells to switch to anaerobic cellular respiration. During this anaerobic process, pyruvate within our cells creates energy without oxygen, which gives off a byproduct into our bloodstream called lactate. As this lactate builds up within the body, this puts our patient into a state of metabolic acidosis. When our body recognizes this state, it signals to the lungs to breathe faster with a goal to rid the body of CO2 as quickly and efficiently as possible. Now, when we take our end-tidal CO2 monitor and place it on this patient, we will notice that their CO2 levels may be lower than that of our well patients. There is an inverse relationship between lactate levels and expired CO2. What this breaks down to is that when the lactate levels rise in the bloodstream, the CO2 levels decrease. A study published in the American Journal of Emergency Medicine in 2013 concluded that end-tidal CO2 levels less than 25 millimeters of mercury were strongly associated with serum lactate levels greater than 4 millimoles. This is a very useful tool that can accurately predict increased mortality in our acutely ill patients. So how should we best utilize end-tidal CO2 monitoring for our patients? First off, remember that end-tidal CO2 on each individual is not a reliable way of detecting potential sepsis. We need to complete a detailed physical assessment to identify these sick patients. If we look at our sepsis protocol, we will see that we should be performing a sepsis screen on these individuals that we identify as possibly being septic. Does the patient have a temperature greater than 101 or less than 96.8? Is their respiratory rate greater than 20? Remember that, as we just discussed, an increased lactate level will signal our body to increase our respirations as a compensatory response. Is the patient's heart rate greater than 90 beats per minute? If the answer to at least two of these questions are yes, then we continue to the second part of our screening. Does the patient have a suspected or documented infection? At this point, it is vital that we obtain a detailed medical history. We would absolutely want to know if our patient had a recent hospitalization or procedure that may be contributing to their current condition. And finally, is our patient currently on antibiotics? An individual that appears ill and is displaying these signs or symptoms of possible infection or sepsis, as we have discussed, should be placed on an end-tidal CO2 monitor to assess their current CO2 levels. In conclusion, end-tidal CO2 monitoring is a very useful tool that we can implement with our sick patients. Know that end-tidal CO2 levels less than 25 millimeters of mercury in these patients is strongly associated with elevated serum lactate levels and in turn sepsis. Understand that while end-tidal CO2 monitoring is a reliable predictor of sepsis, it does not take the place of a detailed assessment. If you have any questions, please feel free to reach out to your supervisor or anyone on the Quality Assurance Quality Improvement team. As always, thank you for what you do, stay safe, and have a great day.